Good day, my name is Shilami Awak, student from the University of the Visayas with Bachelor of Science in Nursing 1. So for today's video, I'm going to demonstrate the vital sign, which is pulse rate. Is bending of blood falls in an artery that is palpable at various points on the body. It is a wave of blood created by construction of the left ventricle of the heart, and there have a 9 pulse site: temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and pedal. So the purposes of this procedure is to determine the deficiency of peripheral circulation of presence of pulse deficit.
So first is introduce self and verify client's identity. This is to establish proper nurse-patient's relationship and to ensure that nurse is carrying out the procedures with the correct client. What is your name again, sir?
My name is Joshua Ostero.
Thank you. Explain is what you are going to do and why it is necessary. So karon sir, mag-rate ko sa imuhang pulse rate.
My name is
Explaining the procedure and giving information to the clients build trust and cooperation. Next is perform hand hygiene. So wash hand is important to prevent contamination and spread microorganisms. So next, provide for the client privacy. Hygiene is a personal matter and the giving privacy is the client's basic right. By respecting this, the nurse can foster client's comfort and participation. Next is flex client's elbow and place lower part of arm across chest. This is to have a better view of a radial part of the arm to attain accurate pulse rate. So next is support the client's waist by grasping outer aspect with thumb. So this is to assess the client in the comfortable arm position when getting the rational pulse. Next is place your index and middle finger on inner aspect of the client's waist over radial artery and apply light but firm pressure until the pulse is palpated. Fingertips are sensitive and can feel the pulse rate. Using the thumb can lead to an inaccurate pulse rate, and the pressure applied must be light but firm to get an accurate pulse. Next is identify pulse rhythm and pulse volume. Rhythm and volume inferences are minor in counting the pulse rate appropriately and accurately. Next is count pull rate by using second hand on watch and 1 full minute. Counting for a full minute facilitates a more accurate attendment for the pulse. Allows assessments of rhythm and pulse volume as well. Next is document the pulse rate in the client's record. Documentation provides ongoing data collection. Documenting the results immediately prevents the nurse from getting unimportant data, and those data will be the basis for the future nursing action. So first is introduce self and verify client's identity. This is to establish proper nurse-patient's relationship and to ensure the nurse is carrying out the procedures with the correct client. What is your name again, sir?
My name is Jasper Oxtero.
Thank you. Next is explain what you are going to do and why it is necessary. So karon sir, mag-rate ko sa imuhang pulse rate.
Is
Explaining the procedure and giving information to the clients build trust and cooperation. Next is perform hand hygiene. So wash hand is important to prevent contamination and spread microorganisms. So next, provide for the client privacy. Hygiene is a personal matter and the giving privacy is the client's basic right. By respecting this, the nurse can foster clients' comfort and participation. Next is cleanse our cleanse our paste and diagram of stethoscope with an alcohol swab. This is to prevent cross-contaminating and to ensure clear and recess escalation. Next is raise client's groin to expose sternum and left of heart. This provides the better view of the This provide a better view of the apical part of the arm and to attain accurate reading of the apical pulse. Next is locate apex of heart. Place stethoscope at the 5th ICS in order to hear PMI. This is to ensure that the heartbeat is clear and credible to get the accurate apical pulse rate. Next is inform client that you are going to listen to his heart, instruct to remain silent. Okay sir, please. Ay, okay sir, paminaw na ko yung heart rate, so silence na lang. This is to ensure that the place is in a free noise environment, free from distraction during escalation. This is also faster accuracy in the getting an accurate reading for the pulse. Next with the dominant hand, put earpiece of the stethoscope in your ears and grasp diagram of the stethoscope in palm of your hand for 5 to 10 seconds. Is this warm to diagram of the stethoscope, ensuring that the clients will not started when placing the stethoscope on your chest. Ay, placing the stethoscope on the chest. Next is place diagram of stethoscope over the PMI and oscillate first sound S1 and S2 to hear lub-dub sound. Listening to the lub-dub sound is the basis in counting and assessing client's heartbeat. Next is note regularly of rhythm. The regularity of the rhythm reveals pattern of time intervals between each heartbeat. Next is start to count while looking at the second hand of watch. Count lub-dub sound as one beat. Count rate for the full minute. A full minute provides accurate assessment, especially if the heartbeat has an irregular rhythm and which lub-dub
Findings.
sound is counted as one heartbeat. With client. It is the client right to be informed with the if informed. Is fastest trust and cooperation in the implementation of nursing environment. Next is record the findings. Documentation provides ongoing data collection. Documenting the results immediately prevents the nurse from forgetting unimportant data, and those data will be the basis for future nursing action.